Mrs. Princey, Associate Professor in Mental Health Nursing. I've got a case of 49-year-old female who had the complaints of sleep deterioration and would laugh to her own self, okay, with no apparent reason. And whenever her relatives or family would ask some questions, her answers were so irrelevant and incomprehensible. She often remained indoor, would not interact with her family or neighbors or any friends, and would become very much agitated when her privacy was intruded. She also believed strongly that she was the wife of Jesus Christ and had received instructions through the vision that she had to keep herself very pure. She had to keep herself very pure and remain in isolation till Jesus comes. She refused the meals prepared by her mother, believing them to be poisoned. Yes, by listening to this case presentation, you would be able to diagnose the condition of the client. Yes, the diagnosis is psychosis. So the main diagnosis of the client here is the paranoid schizophrenia. Yes, the topic which I'm going to discuss today is about one of the psychotic conditions which is very common, which is the schizophrenia. Before going to schizophrenia, let us learn what is psychosis. The term psychosis is defined as the gross impairment in reality testing, marked disturbance in personality with impaired social and occupational functioning, and presence of the characteristic symptoms such as the delusions as well as the hallucination. So if you take a psychotic condition, there will be gross impairment in the ability of the thinking. Along with that, the person will have this peculiar characteristic feature of delusion and the hallucination. Now, let us see what is schizophrenia. Schizophrenia is one of the psychotic condition or the disorder. So, who is the person who coined this term schizophrenia? The word schizophrenia was coined in the year 1908 by a Swiss psychiatrist, Eugene Bleuler. It is being derived from the two Greek words, that is schizo, which means split, and phren, meaning mind. So, you can simply term it as split of mind. Let us see the definition of schizophrenia. Schizophrenia is a psychotic condition characterized by disturbance in thinking, emotions, volitions, and faculties in the presence of the clear consciousness, which usually leads to the social withdrawal. So you understand here it is a psychotic condition. When I say a psychotic condition, there will be a presence of delusions or hallucination, which is the main characteristic feature. Along with that, the person will have a disturbance in his thinking, in his emotions. So if you take the emotions, it can range from apathy to blunt affect or flat affect. So the emotions are so much mixed. And there will be disturbance in the volition. So what do you mean by volition? It is the motivation which a person has. So here the patient will be demotivated. So no motivation from himself. Okay, no initiation from his end to do any of the activities. So volition is disturbed, and other areas in his life, it can be the occupation, it can be the relationship, it can be the work. So all these areas will be disturbed, wherein the person, drastically will withdraw himself from the society, goes for a social withdrawal or an isolation. So that is what is the condition termed as schizophrenia. Let us see the various types of schizophrenia. According to ICD-10 classification, the schizophrenia has been classified. So let us see the ICD-10 classification of schizophrenia. The chapter F20 to F29 completely talks about the schizophrenia, schizotypal disorders, as well as the delusional disorders. So F20 deals with the schizophrenia. F20.0 is the paranoid type of the schizophrenia. F20.1, hebephrenic schizophrenia. F20.2 is catatonic type of schizophrenia. F20.3 is undifferentiated schizophrenia. F20.4, post-schizophrenic depression. F20.5 is the residual schizophrenia. F20.6 is the simple schizophrenia. F21, we have got the schizotypal disorder. So this is about the ICD-10 classification of schizophrenia. Let us move on to the epidemiology. So, what is the prevalence of this disorder? So, it is the most common type of the psychiatric disorders which is present throughout the world, and it is prevalent in all the cultures around the globe, right? So, it is the most common psychiatric disorder. About 15% of the new admissions which happens to the psychiatric hospital is belonging to this category of schizophrenia. So you can take about 15% of the new diagnosis or admission to the psychiatric hospital is of schizophrenia. If you take the bed occupancy, about 50% of the inpatients, that is the bed occupancy, is of the schizophrenic condition. So 50% of the patients belong to this category or the disorder of schizophrenia. It is found that about 3 to 4 per thousand population in every community suffer from this condition, schizophrenia. Out of 1,000 people, at least 3 to 4 people, they have this condition called as the schizophrenia. If you take the general population, there is about 1% of chance for the general population to develop this condition in their lifetime. The men and the women ratio, the gender ratio, is equal. That is, both the gender have got equally the condition. If you take the age group, right? So the most common age group, about 2 to 3 of the cases of schizophrenia falls between the age group of 15 and 30 years. So if you take in case of men, the peak age of onset is bit earlier compared to the women. So it is between 15 and 25 years is the peak onset of schizophrenia in men. And in case of women, it is between 25 and 35 years. This disorder, schizophrenia, is very common in the low socioeconomic status group. Right? So that is about the prevalence, or we can say the epidemiology of schizophrenia. Now, why do the people develop schizophrenia? What is the reason, etiology behind schizophrenia? So we have got the list of theories which explain not one theory or one cause is being noticed for schizophrenia. Okay, so we have got some theories. The first theory which explains the cause is the biological theory. Then we have the psychodynamic theory. The third one is the vulnerability stress model, and the last causative theory is the social factors. So let us see each of these theories in detail. The first one is the biological theory. So under the biological theory, we have got some factors. Number one is the biochemical theory. Number two, we have got the neurostructural theory. The third one is the genetic factors, and the fourth one is the perinatal factors. So if you take the first part, which is the biochemical factor, so we have got the influence of certain neurotransmitters which are disturbed in the psychiatric conditions. So in case of schizophrenia, we have got this neurotransmitter which is the dopamine, which is causing the schizophrenia. So increase or excess level of dopamine has been found in clients who suffer from schizophrenia. It is also found that there are some abnormalities in the other neurotransmitters as well as the neuroregulators. So the neurotransmitters which are disturbed are norepinephrine, serotonin, acetylcholine as well as the GABA. Right? So these are the other neurotransmitters wherein you can find out there is an abnormal distribution of these. Apart from this, we have got the disturbance or abnormalities in the neuroregulators like prostaglandins as well as endorphins, right? So these are also being disturbed in the schizophrenia. So the main neurotransmitter which is having an imbalance is the dopamine, wherein there is excess level of the dopamine as well as the abnormalities in the neurotransmitters as well as the neuroregulators. That is the first biological factor, which is the biochemical theory. The next theory is the neurostructural theory. So as the name says, neurostructural, there are some abnormalities at the structural level or the structure of the brain. Right. So let us see what is the change in the structure. The CT and MRI of a brain of a schizophrenic condition revealed certain things or the changes in the structure. So what are those? Number one, decrease in the brain volume, larger lateral as well as the third ventricles, atrophy in the frontal lobe, cerebellum, as well as the limbic structure. There were the shrinkage of these lobes or the areas. And also there was increased size of the sulci on the surface of the brain. So these were the changes in the structure when it comes to the neurostructural theory. Right. So this is the change that we can find out in the brain of a schizophrenic client. The next theory under the biological theory is the genetics, right? So according to the genetics theory, they explain that the condition is more common in people who are born of consanguineous marriage. If you take the identical twins, about 50% of the identical twins are affected with the schizophrenia. If you take the sibling, if one of the sibling has been affected with schizophrenia, there is a 10% of the chance for the other sibling also to develop schizophrenia in their lifetime. If one of the parent has been affected with schizophrenia, then there is 15% of chance for the child to develop schizophrenia in their lifetime. And if both the parents are affected with schizophrenia, there is 35% of chance for the children to develop schizophrenia in their lifetime. There is 2 to 3% of chance for the second degree relatives to develop schizophrenia if the condition has been found in the family. And if you take the general population, about 1% of chance is there in the general population to develop schizophrenia in their lifetime. So this is about the genetics. Moving on to the last factor, that is the perinatal risk factor. So what is this perinatal? So perinatal is a period from the time of conception to the delivery. So we have got the antenatal period, intranatal and postnatal period. All three together it is termed as the perinatal period. So during the perinatal period, if the mother had developed any kind of the conditions or had any kind of complications, then there is a chance that the child will develop schizophrenia in their lifetime. So what is it? Let us see. First thing is the mother is affected with the maternal influenza, then there is a chance that the child or the baby may develop later on in the life schizophrenia. The babies who are born during the late winter or early spring, any kind of complication which happens during the pregnancy or during delivery or the labor, right? So it can be injury to the head of the child or the baby, or any kind of infection during the pregnancy, or any kind of the complication which happens during the labor or during the pregnancy. Such a kind of a baby who is born later on in his life may develop the schizophrenia. So that is about the perinatal risk factors. So this is the first, theory which completely explains the biological reason why the person may develop schizophrenia in their lifetime. The second theory is the psychodynamic theory. So under the psychodynamic theory, there are a few factors. The first one is developmental theory as well as the family theory. So according to the developmental theory, we have got the Sigmund Freud who explains about the personality development. So that is the psychosexual development of a person. If the individual is having very poor ego boundaries, we can term it as fragile ego or inadequate ego boundaries, or if the psychosexual development is arrested, or the child may not be able to use the adequate coping mechanism, right? So he may regress to the previous stages of the development. So you can understand that if an individual is not able to use the ego defense mechanism appropriate way, so the ecosystem itself is not being developed, so in those individuals they will be at risk of developing any of the psychiatric conditions, right? So it is not only schizophrenia, any psychiatric condition they can develop in their lifetime. So one of those contributing factor for schizophrenia is the poor ego boundaries. So that is what the developmental theorists explain. The second theory in the psychodynamic factor is the family theory. So under the family theory, we have got mother-child relationship, dysfunctional family system, as well as the double-blind communication. So the first thing is the mother-child relationship. So it is found that the children who have developed this schizophrenia, right? So if they had collected their history from the person or from the mother, it has been found that the relationship between the mother and child is found to be very cold. So what do you understand that the relationship is very cold? In a sense, the affection towards the mother and child, the relationship, the bonding is very poor, right? Or the mother is being very much overprotective or domineering type, dominating the child in many of his activities, not giving the independence for the child, to autonomy for the child to exhibit as things. So such a kind of a child would have developed a very poor ecosystem, which contributes to schizophrenia. So that was the first one, which is the mother-child relationship being very cold, overprotective, domineering, not giving the autonomy for the child to exhibit as independence. The second one is the dysfunctional family system. If there is a lot of conflicts in the family, okay, the family system is not functioning appropriately, a lot of hostility, that lot of hostility, lot of conflicts which happens in the parents, wherein the children who just witness that can undergo such a kind of a pressure and stress that later on in their life can develop the schizophrenia. The next thing is the double blinded communication. So what do you understand by double blind communication? So here the child is being witnessed as being blind. Why? Because there are two or more incompatible messages which is being passed by the parents. Say for example, the mother says a particular message, the father says just the opposite. The child is very much blind, not being able to understand and decide whether he has to understand and follow what the mother is saying, or should abide to what the father is saying. So there are two different messages which is being past, which is so much incompatible, the child is not able to decide. So his child is in such a dilemma that he is into a lot of stress, that he is not able to decide whom to follow, whom to obey. So in those situations, the child is blind for the two double communication at the same time. Right? So such a kind of a child who's raised in such family can develop schizophrenia later on in their lifetime. So that is about the psychodynamic theory. Moving on to the third theory, which is the stress vulnerability model. According to the stress vulnerability model, if the person had any kind of the biological factors, so you have seen in the biological theory, we have got an imbalance in the neurotransmitter, we got the genetic factors or perinatal factors, or we have got the neurostructural factors, any of those factors, along with the poor development of ego. If the person is not having the use of proper coping strategies in his life when he comes across this stress, so both these factors, along with the stress when he's not able to, overcome, he may end up with these schizophrenic symptoms, right? So that is what is the stress vulnerability factor or the theory explains about. The last one is the social factor. According to the social factor, schizophrenia is more prevalent in the areas where there is high social morbidity and disorganization, especially among members of the very low socioeconomic status or the group. So you'd have experienced people who are into this low socioeconomic status, so they have got a disorganized lifestyle, they have got a lot of social morbidity, right, within their community. So such a kind of community wherein the people are being grown or they've been reared, so which can contribute to a lot of stressors in their life. It can be the financial stress, or it can be the poverty, or it can be the family wherein there are a lot of conflicts and disorganized family system that you can notice in such a kind of a low socioeconomic status group, which can precipitate this condition of schizophrenia, right? So that is the social factors. Okay, so these are the various etiological theories which explain that this may be the reason that the person may develop schizophrenia in their lifetime. Let us move on to the psychopathology. So, what is this psychopathology of schizophrenia? We have got the genetic factors, or the genetic theory, which explains about the risk factors of developing schizophrenia in their lifetime, right? So, genetic predisposition or any kind of exposure to psychodynamic factor, environmental factors, social factors, or the psychological factors, all these are going to trigger neurodevelopmental abnormalities. So, neurodevelopmental abnormalities, in a sense, as and when the child is growing in such a kind of an environment with the genetics or with the environmental factors or social factors, there will be a abnormality in the neurodevelopment. So, because of this neurodevelopment abnormality, it can lead to the brain dysfunction, wherein there will be imbalances in the neurotransmitters, obviously leading to the condition of the schizophrenia. Right? So that is the psychopathology of schizophrenia, the etiological factors which causes the poor or the abnormal neurodevelopment, because of which there will be abnormalities in the neurotransmitters leading to the condition of the schizophrenia. We'll move on to the phases of schizophrenia. If you take the schizophrenia, it is not like, immediately the person will get the schizophrenia. There are some phases that the person will pass, when he develops the schizophrenia. The first phase, we have the prodromal phase. The second phase is the psychotic phase, otherwise called as the acute phase. The third phase is the residual phase of the schizophrenia, or the chronic phase of the schizophrenia. Now, what do you understand by the prodromal phase of schizophrenia? In the prodromal phase, before even the person gets the first psychotic episode or the feature, there will be a decline in the general functioning of a person. It can be disturbance in the occupation, disturbance in the relationship, disturbance in the social, relationship. There will be a general decline in the functioning before even the first psychotic feature is developed in the person. The individual will become socially withdrawn, he becomes easily irritable, he will have the physical complaints, or there will be conditions wherein he will newly find himself very much interested in the religion or religiosity or occult. Okay, such kind of the features just before the person develops the first symptom of psychotic kind of feature. Okay, the person will experience these kind of a disturbance or general decline in the functioning of a person. That's the prodromal phase of the schizophrenia. Moving on to the second phase, which is the actual phase, that is the psychotic phase or the acute phase of schizophrenia. So here, the people will develop the positive symptoms of schizophrenia. The positive symptoms of schizophrenia is nothing but the delusions and hallucinations in terms of the perceptual disturbances. Most commonly, the person may develop the auditory type of the hallucination, and also the delusion, especially the delusion of reference, and also he will have the disordered thought in terms of the content of the thought, the stream of the thought, or the form of the thought. So in all these areas, there may be the symptoms which is noted, especially the positive symptoms, hallucination, delusions, and disturbances in the thought, right? So that is the second phase, or the acute phase of the schizophrenia. The third phase is the residual phase of schizophrenia, or the chronic phase of the schizophrenia. This phase usually occurs between the episodes of the psychosis, wherein it is characterized by the negative features. Okay, so what are the negative features of schizophrenia? Mainly, there will be disturbance in the affect or in the emotion part. Okay, there may be a blunt affect or a flat affect, or they may be socially withdrawn, odd kind of a thinking and behavior the person may have. So these are all the negative features that the person may develop in the chronic phase of the schizophrenia, which happens between the episodes of the psychosis or the acute phase, right? So these are the three important phases of schizophrenia. Moving on to the clinical features. So if you take the clinical features, we have got a list of these clinical features. The first one is the Bleuler's 4A symptoms of schizophrenia. So Eugene Bleuler is the person who coined the term schizophrenia. According to him, he has given the 4 Bleuler's 4A symptoms of schizophrenia. Number 1, is the blunt or the flat affect or the emotion. The second thing is autism or the autistic way of thinking. Third is the losing of association, wherein there is no relationship between what the person is talking or saying, no relation in the content of the speech, right? And there will be a conflict to do or not to do between the two opposing forces or the conflicts, right? So these are the Bleuler's 4A symptoms of schizophrenia. Number one is the affect, which is disturbed. Then there is the autistic thinking, losing of association, as well as the ambivalence. The next is the positive as well as the negative symptoms of schizophrenia. So as I told you, during the acute phase of schizophrenia, psychotic phase of schizophrenia, the person will show the positive symptoms of schizophrenia, which is nothing but hallucinations, delusions, formal thought disorders. That is, the thought will be totally disturbed. It can be the content of the thought, the stream, or the form of thought will be disturbed. Then the person may have odd thinking or the bizarre kind of the behavior. So all these are the positive symptoms of the schizophrenia. So most commonly you can notice the auditory type of the hallucination, which is noted in the schizophrenia. Moving on to the negative symptoms of schizophrenia, which happens during the chronic phase of the schizophrenia or the residual phase of schizophrenia, we can notice there is a flat affect, alogia, anhedonia. There is a loss of pleasure in the pleasurable activities. He may not be interested in any of these activities which previously that he was so much interested to, right? But now he is not interested, right? So that is the anhedonia. He may have the avolition, no motivation, no initiation to perform the activities or take responsibility. He may have the inattention as well as the self-care deficit. Okay, those are the negative features of the schizophrenia. Moving on to the third category of symptoms, which is the Snyder's first rank symptoms of schizophrenia. So according to the Snyder's first rank symptoms of schizophrenia, even if the client is having one of these following symptoms for a period of 1 month, he can be diagnosed as having this schizophrenia. So what are these first rank symptoms of schizophrenia according to the Snyder's? Number one is the audible thoughts. Okay, nobody can hear our thoughts, right? So the person with schizophrenia can hear his thoughts. That is termed as the audible thoughts. Next is voices arguing. He can hear the voices which are arguing, right? So such kind of auditory hallucination that he can hear. He can also have the auditory hallucination of voices commenting on one's action, right? So he can hear the whatever